I'm Virginia Prescott with the What You Need to Know Coronavirus web series from GPB. This is a fast moving story. New York City is now the epicenter of the virus, and we are all living in a landscape that would have seemed unthinkable to us even a week ago. We're going to get some clarity today with Dr. Carlos Del Rio joining us via Skype. He's Distinguished Professor of Medicine, Global Health, Epidemiology, and Infectious Diseases at Emory University and Associate Executive Dean at Emory University at Grady Health System. Dr. Del Rio, thank you so much for making some time for us today.
Happy to be with you, Virginia. I'm really at the center of this epidemic and the center of the storm as we see these cases roll into the state. I think about this is a fast-moving epidemic, and as a fast-moving epidemic, it also requires fast and bold-moving actions. And this is a time, it's an unprecedented time, but I'm also confident that we, and I'm focusing here locally, we have in this city, in this state, unique resources, right? We have always said Atlanta is the public health capital of the world. We have
right.
CDC, we have the CARE, we have the Carter Center, we have academic and research institutions like Emory University, like, the Georgia Tech, like, Georgia State, Morehouse. I mean, we have a lot, we have incredible companies, we have Fortune 500 companies, Home Depot, UPS, Delta, that are all headquarters here in Atlanta. So we have the intellectual and the economic capital to do the right thing right now. So therefore, I am very confident that we will get it right here in the state of Georgia.
Well, you've tweeted yourself and you amplified the tweets of others, opinions of others, saying that Georgia is nearing the point of no return of containing the virus. So what needs to be done now?
I think we need several things. And again, I'm going to say Georgia, but the reality is if Georgia does this and the rest of the nation doesn't do it, it's not going to do us any good. We really need federal bold action. But if we're just going to focus here in Georgia, I mean, every governor, the problem is public health is run at the state level, right? And not at the federal level. So the federal government can make recommendations, but cannot issue executive orders to change things. Well, the states are the ones in charge of public health, and that's why we're seeing states take action individually. Now we need all the states in unison to do the same thing. And what do we need? We need to stay at home, and I'm calling this Operation Stay at Home. We need everybody to stay home for the next 15 to 30 days. Let's leave it at 15. This virus transmission is about between 5 and 14 days. For the next 2 weeks, stay at home. And during that time, what we will achieve is two things. Number one, stop future transmissions, because we already have plenty of cases as we are, but we need to stop future transmissions. And I tell you why that is important. With the way this virus reproduces, one infected person today results in approximately 2.5 infected persons in 5 days, but that results in 406 infected persons in 30 days. If we're able to decrease contact of that one infected person today with other individuals by 75%. I'm not talking about 100%, 75%. In 5 days, that will result in less than one infection. And in 30 days, we will only have 2.5 to 3 new infections. So if you do the right thing, instead of in 30 days having 400 infections, you have 3 infections. That is huge. I mean, the number one thing we achieve is we achieve future transmissions. Number two, that buys us some time to scale up testing. And by scaling up testing, we'll be able to really, and I'm talking about being able as a country to start testing 50 to 100,000 people a day, really to find who's infected. We don't have any idea where those infected individuals are. But if we truly scale up testing, we will be able to find infected individuals. And what we do is we take those infected individuals and we put them in isolation so they don't infect other people. And the third thing we do during that time is we shore up our healthcare system. We make sure we have the appropriate PPE, we have the appropriate ICU, bed supply, et cetera, so we don't get overwhelmed. And by doing those things, we're actually doing what's called flattening the curve. We're preventing an onslaught of patients to come to our hospitals that would actually make our healthcare system collapse. So those are the things that need to happen.
Well, these are terms that have been discussed a lot publicly and privately in the last couple of weeks, flattening the curve. But do you think people are taking it seriously enough? I mean, there are people fluttering Washington, D.C.
No,
For the Cherry Blossom
no,
Festival, still think
no.
on the beaches.
People are not taking it seriously, and that's why we need leadership. This is when we need, you know, this is when we need national leadership and local leaders to stand up, and religious leaders. I mean, I'm not seeing the religious leaders out there. I'm not seeing the different leaders, the sports leaders in the community. Where are the leaders saying this is what we need to do? Where are people when we need them? I mean, where do we have our business leaders, our spokespeople out there in the news and in everywhere? It is not just us, the public health experts and the medical experts. We need the leaders in the business community. We need the leaders in the religious community, in every single aspects of in the political community, to come out there and say, this is what we're going to do. And I have confidence that if we do it, we will stop this virus.
Well, you have seen in extraordinary efforts made in China, in Taiwan, in Singapore. They've actually flattened the curve or even turned around the transmission, or let's say put COVID-19 on its heels temporarily. But that took extraordinary efforts. And those are efforts that I think people in the United States, with our dedication and commitment to individual liberty, resist, especially government action.
Well, then we need to start looking for where we're going to bury our dead. Okay. I mean, that's a decision we have to take. It's a decision between life and death. This is not a decision about anything else. I mean, this could result in, if you have a third of the U.S. population infected, which is a pretty reasonable estimate, that's 100 million people plus infected. If you have a mortality of 1%, which is pretty low, right now we're running about 3.5% in the U.S. But let's say the mortality was 1%. That's 1 million people dead in the next year. If we're ready for that, then, I'm all in favor of your individual liberties, but just start finding where you're going to bury your people, because quite frankly, this is not a joke.
Well, we know that. And we know that, of course, governors are now begging the federal government for assistance with equipment. Where do you think Georgia's hospitals are in terms of readiness for an influx of patients?
Nobody's ready. Nobody's ready in Georgia, in California, across the nation. We're not ready, because we simply cannot take this tsunami of patients happening. That's why we're talking about flattening the curve. If we can spread those patients over time, we're going to do a better job.
Let me talk a little bit about the nature of the spread. We know, of course, it can be rampant, but as we saw on the Diamond Princess cruise ship, it's the cluster effect. It is family members. It is colleagues.
Correct.
Is there some hope in that clusters themselves can be contained?
Yes, by testing. The moment we start wrapping up testing, then you can find somebody infected and you can quickly get to their contacts, right? But right now, we're dark. We're in the dark. We're not testing enough people. So but in order to ramp up testing, we have to stop the transmissions from ongoing. We need to stop transmissions now. I mean, I cannot stress to you how much buying some time is going to be critical in the response. The federal government did this when the federal government said we're going to go on a 14-day slowdown, stay at home. If people had followed the advice that was given, a week ago, we would be in a very different place. But the reality is we haven't.
Well, one of my colleagues obtained a letter from the hospital administration of the Phoebe Putney Memorial in Albany. It was a letter to staff saying hospital staff are being told to return to work if they are coronavirus positive but asymptomatic. Now, I'm unclear if this is just in COVID-19 areas or in the hospital in general. This has gotten locals very shaken up. Might this be an acceptable practice of separating doctors who may be symptomatic or other healthcare workers?
I haven't seen the letter, so I cannot comment, but I can tell you, as you have more and more infected healthcare workers, if they stay home, you're not going to have healthcare workers. So you better have healthcare workers that are infected coming around taking care of others than saying everybody infected is going to stay home. So again, that's the challenge we're facing, right? This is a battle. And if your soldiers are getting injured, are you going to leave them home, or are you going to, have them come to the front lines? They'll put a mask and continue working. I mean, this is the desperate situation, and this is what people need to understand. This is going to get, and I feel bad for Phoebe Putney Memorial Hospital. They're in dire straits.
They're under siege.
and they're under siege. And we need to wake up and I mean, do you want your local hospital to be under siege? Then just, continue doing and paying no attention.
So you said something about leadership. Now, we have been hearing an awful lot from politicians about this. Are we hearing from enough scientists, do you think?
This is a cancer, right? This is a bad disease. And you need to take chemotherapy, and the medicine you need to take is pretty rough. It's not going to be simple. So we need to tell people the truth and say, look, this is going to be rough, but I also, we're going to get this over this. I want to be realistic, but also optimistic. We are going to get over this, but we all have to do it together.
Well, the administration is now saying it's taking 15 days and it's going to reassess that social distancing, those guidelines and strictures.
Well, but again,
what do you think?
They give guidelines, but we haven't executed. We need execution.
Okay, so Dr. Del Rio, your appeal to the United States. Not be
My
very
appeal
immediate needs, they're not seeing that they're sick.
My immediate appeal to the nation is take action now. Stay at home. The president said it very well last week. Stay at home and save lives. We have to take that seriously. Stay at home and save lives.
Dr. Carlos Del Rio, thank you so much for your time.
Happy to be with you. And again, thanks for all you're doing.
We have recorded a number of videos for this What You Need to Know Coronavirus series. You can find all of those, plus resources and up-to-the-minute news at gpb.org/virus.